Take it away, Courtney.
Thanks for the introduction, Jen, and thank you for organizing this. Jen has organized all of our webinars, and I just want to say thank you for bringing us into the 21st century, Jen. Wonderful.
My pleasure.
We appreciate it. So thanks to everybody for joining us. I'm really excited to have this group of people here and to have people online so that we can make this a broader discussion. So I'm Courtney Howard. I'm board president of CAPE. I'm from a planetary health perspective, I'm on the steering committee of the Planetary Health Alliance, and Alastair Brown there got bonked on the head one day and asked me to be on his editorial advisory committee too. So that's how I came to know this person who's going to help us out. So Alistair has had a really interesting path. So he came from more of the pure sciences, and he was a editor at Nature. And then he came from there into his work at the Lancet about a year ago. And so he's now the senior editor of the Lancet Planetary Health. And it's been really interesting having discussions with him over the course of the year as he sort of had these new eyes into the medical community. It's something you only get once. And so as a doc, I've been sort of enculturated in there for 20 years now, and it's been really interesting having some of his insights. So he has a big brain that spans many disciplines and is not quite as sort of indoctrinated into the way things are. And I find that that's giving him a lot of new insights, and I'm really excited to hear what he's going to share with us today. And we have Dr. Yassen Tcholakov, who is an incredible public health. You've just graduated, right, Yassen?
Just about to.
Just about to graduate. So despite the fact he's only just about to graduate from his public health residency, he's already been an incredible national and international change maker in climate change and health. When I first went to COP21, the day I was about to meet the board of the Global Climate and Health Alliance, this young, fast-walking man found me at the bottom of the elevator and then walked me upstairs. And I was like, who are you? He's like, I'm Yassen, I'm from Canada. I'm like, what? And he had already been active on the international stage for a long time. He's now has an important role at the World Medical Association, whether you're talking about the World Health Assembly or COP. When I showed up at COP, I actually appointed myself Yassen's resident a couple years ago, and that was a really good move. So he has a very good sense of both the really practical public health elements of the COVID response, as he's been an active part of managing that in Quebec. And so he'll help us draw links between COVID and climate. And so thank you to everyone. I'm gonna just to introduce people to the concept of planetary health, if they haven't already been introduced to it, I'm just gonna share just a couple of slides, and then we're gonna launch into Alistair, because he's joining us from across the pond, and we're gonna make him talk for as long as we can, because we're really interested in what he has to say, and we kind of want to get our money's worth of that interaction. I mean, we're paying him nothing, so I'm sure that it will be very good. Here are our Twitter handles, in case anybody wants to tweet out. So many of you know that I live in the subarctic, so I'm sitting here in Yellowknife. This is Yellowknife's Dene territory. This is a picture of part of the globe that we cover here. So I work in the home of Canada's most northerly CT scanner as an emergency doctor, and this is part of the area covered by my patient population in the Mackenzie River Delta. So I took this picture flying between Inuvik and Aklavik. This part of the world is already over 3 degrees Celsius warmer than it was when an 80-year-old elder was born. So you can imagine how different life is. You see there's a lot of water there. 3 degrees is a big difference when you're talking about the difference between solid water and liquid water. And so whether it's food security impacts, mental health impacts, what it means to people who live really close to the land when the land changes really quickly. It's something we talk about a lot up here, climate change and planetary change. And I've been really lucky to do my learning in a place with so much Indigenous knowledge, because it's really helped ground how I approach this. And so when we think about planetary health, I think really this is about changing the frame. So when I went to medical school, I really thought that health happened inside the hospital, and that's what I told myself as I lived there for my entire decade of my 20s. And I'm really proud of the work that I do in the emergency department. So I've been working in the Emerge here in Yellowknife, and we've entirely revamped the system to cope with COVID-19. And I'm, incredibly proud of the public health response, the public health Canadian healthcare system and universal healthcare, because they've just been, key. But that's actually not all what health is. So this is me and my, C+ in grade 7 art drawing skills with new technology. When we think about health, we need to think about what underpins what we usually think of as health and healthcare. So if you think about it like a nest, the very bottom of the nest are things like ecological determinants of health, like water, oxygen, food, fuel, and the climate. And if that's stable and is able to provide a high degree of sort of concentrated resource, we can create social systems, economic systems that allow us to do things like build roads and build buildings. And those generate what we call the social determinants of health. So I think I had 2 lectures on this in my entire medical school career. Medical schools are better at this now, but it's something that we don't often think about when we talk about health, but really this is where income comes in. So when we're talking about basic income supplements, et cetera, this is how that impacts health, because income is really one of the main determinants of health. And so if that's all going really well, then we can build the extremely complex structure that is a hospital. So most people are pretty surprised to learn that if you do a lit review across countries, and Trevor Hancock and I did this a couple of months ago to try to figure out what percentage of overall health can be attributable to healthcare, it's about 20%. So in Canada, prior to every election, we always do surveys and say, hey, what's the most important issue to you? And healthcare is at the top, but there's no option for health. And when you really ask people, it's not healthcare so much they worry about or that they want to optimize, it's health. And it doesn't matter whether I'm speaking with decision makers or whether I'm speaking, as a board member of the Canadian Medical Association, I find that I'm continuously having to remind people that they're not the same thing. So as we talk about a healthy recovery, really think about all the different elements that add into health. So, we need the climate to be stable in order to have, an economic system and income in order for us to have enough resource to have, the healthcare that we depend on so much. And so as we're thinking about motivating a healthy recovery, I just want everybody to, let's just really think about what that means. As science trained people, we tend to be excellent at giving people facts and not particularly good at telling them stories. And we need to really have in our heart as we move forward what story we're going to talk about as we want to motivate people to have take whatever action we think is best. And so I like this schema by Marshall Gans, and you can do different kinds of lit reviews, but they often draw for these concepts. So if we're asking people to take action on something, things that activate people are urgency, anger, hope, solidarity, and the feeling of you can make a difference. And the things that inhibit action are just general inertia, apathy, fear, isolation, self-doubt. So as we're chatting today, let's talk about how we can, given the evidence base around planetary health and where we think we could productively go to maximize the health of our population, thinking about all of those different layers, how can we tell stories based on patients, based on successes elsewhere that generate emotions in people? And I like people to spend more time in the hopeful areas of the action motivators, because what I'm seeing very much in the emergency department and online is just a tremendous degree of anxiety and uncertainty in people. And so whereas before in the climate movement, we were using a lot of anger to motivate people, a lot of urgency, I'm not seeing a lot of extra energetic buffer in our buckets for us to be able to use those in a way that feels good to us, in a way that I feel like we're enhancing people's wellness. Another brutal picture I've done recently that has seemed to resonate with people is if you think about energy as what you can carry around with you in a day in a bucket. And there's a children's book that talks about this. There's a lot of things these days that are removing that energy from people's buckets. So uncertainty, whether it's about, I was listening to a restaurant owner this morning talk about whether he should open up or not, financial worries for many people, loss of a sense in the place in the world or a role in the world, whether your industry's place in the world is changing, whether your sense of your sort of what you can expect of life, are you going to be able to go on that international vacation, is changing, different types of inefficiencies, increasingly bereavement. Those are all things that kind of remove energy from people's buckets, whereas a sense of purpose of contributing to positive change making, particularly with other like-minded individuals, love, patience, humor, and practical help, can add energy to people's buckets. So also, as we're discussing how to go forward here, how can we do our best with our actions as leaders to increase people's energy into their buckets? Because I think that in general, the humans need a lot of love right now. And if we have a platform, we should be using it to do what we can to increase just their general feeling of wellness. Because I think that not only is that going to help us feel better, but it's going to help us get to where we need to go. So with that, I'm going to stop sharing and I'm going to turn this over to Alistair.
All right, thanks very much. I'm gonna, as Courtney said, my background's in environmental science and I'm relatively new to the kind of health domain, although obviously there's a lot of overlap with in this agenda. But I guess my perspective, what I bring to the party is I'm a bit of a jack of all trades. And so I've got a little bit of an outsider perspective also. And I hope to, be able to kind of bring some kind of integrative perspectives. Certainly in my job as an editor, a lot of what I'm trying to do is to kind of contextualize information and put it within a wider framework. So I'm just going to try and bring some of that to the party and see how it goes down, basically. So first, really quickly, just mention the Lancet, just because that's where I work, and just so just a little bit of context. That it's named after these kind of two objects, some kind of fairly ancient-looking medical implement and a window. And the notion is that the knife is to be incisive, to cut away useless information, and the window is to bring light. So that's kind of notionally what we're trying to do, is to bring to cut to the heart of the issue and to bring light to important issues. And then just really quickly, Lancet Planetary Health is one of the specialty journals within the group, launched in 2017, and is really interested in covering this kind of intersection of health, society, environment. Gold Open Access Journal, and I've been at the journal for a year. So I won't talk about that anymore. I just want to put it out there. And at the end of the presentation, I will stick my email address up. So if anyone wants to talk to me about any aspects of this, then feel free to contact me. Okay, so Courtney's given us a kind of a definition or some perspectives on planetary health. I'm just going to really briefly give some of my perspective on that. Obviously, the definition that everyone knows is the health of human civilizations, the state of the natural system on which it depends.
Alistair, I'm just going to pause you for 1 second. If you could lean in as close to your mic as possible, then the sound will be...
Am I not loud? Okay.
You're loud when you are close to your mic.
Okay.
Thank you. Sorry to interrupt.
Wave at me if I'm moving around too much. So is this quite sort of a grandiose notion, really, that the health of civilizations and the state of the system on which it depends? It's a very kind of like it's very broad, and but I think that it captures something about the nature of the problem, and I think it's interesting to think of it more as a way to approach the challenges we face today, rather than a new discipline or a new way of looking at the world. It's a kind of, I think it's useful to think that it's an approach to understanding and tackling these kind of challenges of the day in a joined up way. I think that, for me, that's quite a useful way to think about planetary health. And I think you can look at, so I think this kind of like Boyden's biosensitivity triangle gives you quite an interesting perspective from where I come from about how these things connect and where the kind of strength generally lies. And I think the health community and health researchers have traditionally obviously looked at the health of people and the biological system itself, but then also the conditions of health, either through the kind of social determinants or through environmental determinants. But I think it's only relatively recently that the impact of human activities on the environment would be something that would be considered to be in the domain of health. And it's only really because of climate change and because of this notion of the Anthropocene, where the major drivers of human activity on the environment have become so pervasive that it's seen as integral to this notion of health. And I think that's also probably, certainly in terms of the things that I see as submissions to the journal, is still very much more in this prior domain, in these two domains, and we see much less around this kind of relationship between human activity and how that affects the environment. So I think that maybe there's still some work to do there in terms of integrating these fields more thoroughly still as time goes by. And an interesting, I think this is an interesting reflection anyway, is that most of the time when we're studying these systems, we're studying the kind of what's in the blue. So we're looking at people's health, and we're looking at some causative pathway, either through some kind of social determinant, maybe inequality, or some kind of environmental determinant, maybe air pollution, or maybe we're looking at how people are affecting the planet through climate change. But when we actually look to try and get to the solution space, we're really, in most of the time, the big solutions lie in this kind of red box in the sort of human activities. So that gets us into some kind of quite sticky territory. And so I think we often have this narrative of change, that it's a kind of, it's like a managerial narrative of change, so that we find some evidence of some kind of harm, some kind of driving mechanism, and we think this needs to stop, and we sort of kind of like lobby and encourage people to make these kind of, if it's a minor change, it's relatively easy. I think that can work even on a large scale. So if we look at the ozone hole, for example, essentially it was identified through scientific inquiry, the atmospheric chemistry was identified, and then they worked out which compound was the problem, and that they could substitute it, and then they developed an international treaty which led to a practical application of this switch of compounds is relatively effective. And I think that's often the way that we characterize change, but I think that actually in the world, and particularly in this kind of domain of integrated challenges that we're dealing with in planetary health, what's actually required in society is quite a big change. I mean, climate change is the exemplar, really, because what we need to change is just the fundamental way that we organize all of our society and energy systems. So if we're in that domain, then by the time identifying the problem, your work's barely begun, because then we need to start saying, okay, well, what do we need to do next? What do we need to do instead? And then what are the pros and cons of doing this alternative strategy? And then even if that seems very credible and sensible, then that's going to be hotly contested and on multiple grounds. And now you're in the realms of political debate. And I think we're actually starting to see this even within some of the epidemiology in COVID-19, that you're in the political realm, people are playing hardball, people are playing the person, not the ball, right? So that there's people are deliberately trying to put people detract from people's credibility. And we need to ask questions like, who do we engage? How do we engage them, and through which platforms? And there's a real need to develop a kind of coherent narrative which works on different levels. So you need a kind of a deep logic-based narrative, but you also need a kind of a short, snappy, compelling narrative. I also think it's really useful to understand the kind of normative and value-based drivers of your argument, because usually there are there's some values, some basic principles on which you build your rational case. And if you talk to someone who's from a very different school of thought, someone from the political right, typically in our domain, they often have a very different set of values, and you think you're arguing about data, but actually you'd be better off talking about the values that underlie them. I think that it's important when you're engaging with these people that you need to understand their positions, and that some of their views might be legitimate. They're not just the enemy, that they're people that you need to engage with them sensibly. And I suppose the reason I raise this is I think intrinsic to the notion of planetary health, and particularly when you move into the phase of wanting to enact change, is that you move into this very complex space where nobody's an expert on all of the aspects, and it's quite an uncomfortable place to be in certain respects, but I think it is necessarily where you need to be to engage with these challenges. Okay, so I'll move on to the COVID notion. So start with the obvious question, how prepared were we? And I'm talking really about the kind of upstream drivers of this, rather than ICU beds and that side of things, important as that is. So we know that this threat was well known. It was expected. Right? was almost pandemics and epidemics are almost a statistical certainty over time, and plenty of warning has been given. So, and interestingly, rather different from climate science, pandemics have happened before. So we know that this is something that's not contested in principle. With climate science, they had to argue the case that this could actually happen in principle for a decade or so before it was recognized. So should we have been more prepared? And I think if you look at the upstream drivers, we're talking about things like agricultural expansion, wildlife displacement, poorly regulated markets, urbanization, these kind of things. Were any of these things like government priorities prior to the pandemic? And I think that if you're honest, you'd have to say in most cases at a government level at least, no, these are not things that anybody was prioritizing. So even though the risk was clear, some of the key things that we needed to have done to minimize the risks were not a political priority, which I think is important to sort of acknowledge and to ask why that might be. And I think it might be interesting in the fullness of time to kind of like cost some of those what some of those measures might have been. And like responsible agriculture and things, and compared to the cost of the pandemic. But anyway, more importantly, really, is whether we will, in our response post-COVID-19, will we properly consider these kind of upstream issues? Because I have very little doubt that there will be a lot of reactive measures, but whether these kind of more wider risk measures will be incorporated, I think it will be a key question. Also quite interesting, again, from a sort of a climate perspective, I think, although we might not have been very proactive in a kind of an upstream sense, I think there has been a very strong policy response to COVID-19. I'm not saying that it's necessarily always been good or good enough, but nevertheless, certainly compared to climate science, I think any climate activist would be pretty impressed by the level of response and simply the fact that so many governments have done so much, even if it's not necessarily what you think would be the optimal change. And I think for this reason, that within the kind of broader environmental movement, there is a kind of a sense that there is something positive here, that significant social and political changes can happen very quickly when they're needed, but people need to perceive that they're important enough and they're urgent enough. And there are some interesting questions about why that is perceived within the COVID epidemic and not so much within the climate change. And, but yeah, you know, I think that it's interesting that in climate science, in climate change, we've seen essentially very little progress, and the progress that has been achieved is much of which has been achieved through, you know, relatively easy wins. But in this case, governments have been willing to take very strong, bold stance, perhaps because it's time bounded. So, but I think that's very interesting. And but of course, the real test will be what happens next. So as governments try to rebuild after the lockdown, what will they invest in, and will environmental and social factors inform that planning? In practice, we'll probably see a mix, and there'll be some interesting studies out of that, no doubt. But I think that'll be interesting to see. So just some of the sort of opportunities that have come out of this. I think that there will almost certainly be increase in spending on healthcare provision, at least in the short term. There's been, in many nations, there's been enormous welfare spending. Things like financial support for business, investment in the homeless, support for the most vulnerable in society. And that's come off the back, certainly in Europe, from a lot of austerity and welfare cuts. So it's been extremely stark, and it'll be interesting to see whether that carries on when they go about trying to spend or invest their way out of the economic crisis that's certainly going to fall on the back of this. It'll be interesting whether more welfare spending continues, much in the way as it did after the Second World War. There's also been some interesting discussion about government bailouts, so trying to make sure that the public purse either recovers its investment or some wider public good is secured. So there's some suggestions, for example, of tax avoiding companies failing to get government bailouts. And also in France, the airlines been suggested they have to cut domestic flights in order to get government bailouts. So I think that's quite an interesting development. And obviously there's a huge amount of media attention has been focused on this kind of notion of cleaner cities being much cleaner, everything, you know, wildlife recovering. So, and I think cleaner air in cities may well be one of those things that people really appreciate as a result of this like period of respite in that sense, and it could improve. It could move towards faster improvements in city air quality. That time will tell. But perhaps the key question for climate policy will be whether all of this unavoidable government investment, at least in the rich countries, goes into green growth and renewable energy and more equitable societies, or does it just go into re-establishing what we had before and trying to reactively recover as fast as we can to sort of a consumptive model? And again, I expect to see a mix, but that will be interesting to see. There's just a few other sort of opportunities. Obviously, there's been a huge reduction in flying, and there'll probably be some interesting studies on the back of that. But and for us, it really begs the question of how often we need to go to these conferences, and can we do better remote conferencing? And it's forced a lot of innovation in remote meetings. So I think that's for the good. Some benefits from home working, perhaps in reduced transport. I think there's been a real appreciation of green space and the value of green space. And there have been some modest reductions in greenhouse gas emissions, but more modest than you might think, given how hard the economy has been hit. I think that I suspect what will happen is the science and the modelling which has motivated these government interventions will be heavily contested in the coming months. Not necessarily credibly, but nevertheless in social media platforms. And I really think that from a climate science perspective, they've been dealing with this kind of thing for decades, and they've mounted very robust defense of their arguments through the media that the critiques are launched on, for example, YouTube. And I think that even if some of these videos seem completely nonsensical, they will be influencing a lot of people and voters. And I think there's a real need for people to engage with that and to kind of provide, clear, concise, reputable refutations of those kind of arguments. And a couple of other negative things. Obviously, PPE's suddenly become a huge thing, and the vast majority of that's disposable. And there's a bit of a sense that we're obviously health comes for, most people's priorities, health comes first. And so if you need to use some disposable items, then that's fine. But it's kind of going against the flow of this desire to use less disposable single-use items. I think during crisis in general, people are very generally go into short-term thinking mode and recovery mode. So some of these longer societal goals might get pushed back, especially for people who are economically hit hard. And right at the moment, there's a bit of a sense that public transport's out and private transport, often cars, are kind of back in, at least in the short term, because there's there's less chance of infection. Although, of course, in cities, cycling's also a viable option. So I think that there's some definite sort of there's some definite opportunities that are open through this pandemic and the government response. But I think that it's very unclear as of yet whether it will, in terms of wider environmental policy and climate change, whether it's going to crystallize some kind of change or not. I think for those who already believe these things are important, it's clearly seen as evidence for this kind of change. But I think it's very unclear yet whether it's going to help to, the extent to which it's going to help to crystallize those kind of wider views. But perhaps we can discuss that a bit more. So that's all I really want to say up front, and then hopefully we can just have a bit more discussion. As I said, if anyone wants to email me about anything that I've said or any other views, then just drop me an email. Do I need to unshare? Are you back?
Yeah, we can. We're still seeing your screen. Good work. Good work.
Just a delay, I think.
Yeah, thank you. Thank you for that. That's a great perspective on so many of the issues that have sort of come to the fore over the last little while. Thank you. Well, I want to ask questions, but I want to make sure that we sort of will get the whole scope, and then we'll jump into questions. So Yassen is going to now situate climate within this for us. So Yassen and I have been working, excuse me, on the WHO Civil Society Working Group on Climate Change and Health, and we're kind of the joint chairs of the advocacy section. So prior to this, we had decided that healthy NDCs, so healthy nationally determined contributions to the Paris Agreement, and encouraging countries to be ambitious with those on behalf of the child born today, would be our advocacy priority globally for the year. And so I'm going to ask Yassen to now, in the context of what we're now seeing, let us know how you see that sort of shifting as a priority, or whether it's just the messaging shifts around that and the goal remains the same, or the timelines change. So if you could take us through that as you're currently seeing it.
Thanks, Courtney. Please let me know if my sound quality fluctuates or changes in any way. So I'll start with talking about NDCs and climate change and how that links to concepts that we've talked up until now. And then I'll try to move on to kind of the public health things that have been going on and how that has changed the trajectory. So I think that climate change, because of the important synergies that it has with the other dimensions of planetary health, is crucial in terms of an element of action, because it interacts, like presented very nicely, with human health. It interacts, and those interactions are bidirectional. The changes that we make to our environment influence our health, and certain health policy decisions can influence environmental change. Same goes for elements like biodiversity or other environmental determinants of health. So in that conversation, the United Nations Framework Convention of Climate Change, where conferences such as where things such as the Kyoto Protocol, the Paris Agreement are being negotiated by countries on a yearly basis happen. Within that framework, there's such a thing that we call the nationally determined contributions. So that is the voluntary reductions that countries pledge, voluntary reductions in greenhouse gas emissions that countries put forward to the table in order to reach our common climate change goals, which kind of the simplest way of conceptualizing it is staying below 2 degrees, hopefully 1.5, but we've kind of probably walked past that a while back now, unfortunately. But how those things work is every country is free to put forward a contribution of whatever they believe they can achieve and put that on the table, and then everyone comes together and looks at what's on the table and are we able to reach where we want to get to. Obviously, the answer has been so far no. However, the way that this is structured is that every 5 years, countries do this exercise again, and they have an obligation of putting just a bit more every time. In the following cycle, they have to increase their ambitions a bit in order to bring us closer to the objective, with the intention of eventually reaching that final goal. 2020 was a marking year because that is when those nationally determined contributions from the Paris Agreement were supposed to kick in, and a lot of countries were supposed to update those contributions and enhance them, or some have committed to enhancing them, so bringing a bit more to the table. However, now COVID happened, a lot of those expected resubmissions or enhancement or reviews of their NDCs have not yet been submitted, and we're in a current situation where the climate change COP has been pushed to 2021, and there's certain uncertainties in how those decisions will happen. So kind of, I probably can't give you a very enlightened view of what will happen, what the timeline is, partially because I can't see the future and I don't know how COVID will evolve in time. I think that we can hope that there will not be further waves into the places that already had one, and that public health measures will work. However, it's very hard to say. We'll probably have a better picture in late fall of 2020. This being said, now kind of going back to how COVID has impacted that whole process and where we can go from here. I think that basically public health deals with I'm a public health professional. I work on things like climate change, like response to infectious disease, preparedness to things like outbreaks and epidemics. And like any of those disciplines, I've seen that we always work in a resource constrained environment. Prevention is kind of like in the climate change world or in other preventive disciplines, always not put to the forefront outside of times of crisis. Because paradoxically, the better we do our job, the least there seems to be a need for us to do anything at all. I think COVID has now disrupted that kind of steady state where it seemed like things were going well and we didn't need to invest in those preventive measures. I think people are now living in a state where they're not doing things that they used to do. They're not consuming in the same way they used to. They're seeing some of the environmental impacts of those changes that have been imposed to them in their life. Now, I think that if we go back to Courtney's framework of kind of things that motivate change, I think a lot of the changes that have happened now have been motivated by fear. And I think that the whole world is responding very much akin to how an individual does. So it's a sort of global fight or flight response. There's something that has scared us. We react very strongly initially and make important changes. However, I think most behavioral science shows that that's not a good long-term way of making change in a society. I think that now that transition that it should eventually happen is probably starting to happen in some countries, moving from a fear as a motivator as to hope as where we can go and how things can be in the future. And this is where the opportunity space is now being created, because the major disruptions that we've made because of COVID are probably gonna force a reshuffling of the values that are shared by humanity, or the order in which values are placed on the global world order. So that might change how governments together choose priorities for the years to come. And I think that we have an opportunity to put certain of the environmental determinants of health and higher up on that scale. So I don't want to take too much time because I think the conversation will be quite interesting, but I think that it's common saying that crisis creates opportunities and is challenge and opportunity. I think that we have now the opportunity, the chance of trying to take that opportunity and remodel the world to something that it could be more akin to how it should be if we want to live in a steady state. I'll stop here.
Awesome. Thanks so much, Yassen. That's really helpful. So I'm going to just pick up on one of the last things that Yassen said there. And so I liked what you said about the situation being likely to force a reshuffling of the values shared by humanity. And I think that that's a really key point. And I think that we've essentially just demonstrated, or in the midst of demonstrating, that when push comes to shove, we prioritize health. And I think it's really interesting that the response we've asked populations around the world to have to COVID has essentially demonstrated the need for action outside of hospital structures to impact overall health. Like people's social distancing has been a public health maneuver of, a scale that we've never seen. So we have this new opportunity to say, hey, when push comes to shove, we've shown that we demonstrate health as a main value, and that we've all worked together. We all care enough about one another to work together to protect everybody's health. And so I think it's an interesting way to start to show people that they're already part of the public health system and they've already done good, and that could maybe help create some momentum towards continued work towards a shared goal of health. And so thinking about the international sort of governance issues, Ed Chia asked a question right off the bat that's super simple. And so I'm going to give it to Alistair, just, so you can just like, just sort of like cruise on through here and answer this, 30 seconds or less. So Ed asked, who has worked with Doctors Without Borders, so has quite a good international sort of framework. He says, do you think that the early response to COVID-19 of deglobalizing on top of deteriorating multilateralism will be better or worse for the global climate change response? If so, how are we going to overcome this? If not, what are the benefits to efforts?
You're still muted.
So, no biggie.
There we go. It just seems to be a lag, I think. Yeah, it's a good question. I think that one thing this is really exposed is a vulnerability to aspects of the globalized perspective, right? So I think that part of our response, which has basically been to shut down supply chains and to shut down trade and to shut down our economies, it's had the positive benefits that we've talked about in terms of it's essentially stopped lots of polluting and lots of things that it's allowed us to have some respite. But in terms of the international politics, I think the picture is much more mixed. Obviously, we've got China and America kind of facing off and looking like basically pointing the finger of blame rather than collaborating, and then the America's stance towards the WHO was also very unhelpful. So I think that it's not at all clear that this is a kind of even though the way we've responded has actually been quite uniform in certain respects, and possibly a certain amount of bandwagon jumping. I think after a certain number of countries went into lockdown, I think it would have been politically very risky to not do that. And I mean, probably Sweden's the closest example to a country that's kind of trying to play a slightly different version of that. But most countries have a similar response. But in terms of climate change and whether we're likely to come up with some kind of ambitious target as a result of this, I'm not I'm not that hopeful, to be honest, that this is going to, at the international level, at the level of international agreements and ramping up targets, I don't really see the evidence that is that encouraging. And actually New Zealand's already submitted their revised NDC, and it's not any more ambitious or barely. So, and New Zealand's often seen as a kind of a climate leader. So obviously they're relatively small in the emission stakes, but I think there's a lot of reason for concern, as well as, that this might be an opportunity for enhanced ambition. I think that there are a number of big players are not looking like they're particularly going to start ramping up their ambition just now. So I think that's one of the big questions. And I think in a year or so, we might feel it's hard to tell at this point whether we'll see this as been a positive thing or a negative thing in terms of the Paris pathway.
Maybe just a comment on the globalization aspect. I think that what we've seen globally is countries closing down as a public health measure. I don't think that the closures are necessarily indicative of a desire to deglobalize the world. I think that we've seen critique from the US towards WHO, and we can probably argue for a long while whether that's truly related to COVID response or just something else that coincidentally happens at the same time given US politics. However, I think that COVID is a very interesting illustrative example of why certain elements of integration within the world can be helpful, because without a strong WHO, the response would not have been the same, and a lot of more people would have died. Whether there's things that can be better, certainly, but I think that most countries around the world realize that there needs to be some sort of global governance system for public health and for other global issues like climate change. I think WHO has mechanism, at least for infectious diseases, which is kind of the one example, that are a bit stronger than other UN bodies have for other things, like the UNFCCC and being a good example. But I think that we may come out of this more in a stronger multilateral with a stronger sense of multilateralism around the world. This being said, I think that there might be a reshuffling of who the strong players around the table are. Some might lose their privileged spot, others might gain that privilege.
Yeah, I think that makes sense. And I think it's, as we think about how we emphasize the role that the WHO has had, I think it's pretty important we take what Alistair said about responding to criticisms in the media in which they've been made into account, because we may know that the WHO response was critical, but I think it's really important we tell the story of how absolutely important that was to make sure that there's social license for policymakers to continue to engage and to really emphasize that message that, you know, this is proven that we're all in this together, you know, that what happens on the other side of the world impacts our health here. And so there's, you know, I've been working with some medical students on an essay recently, and they used equity as the main motivation for change in the first bullet point in the first part of the essay. And it was the first time in my life that I've had to edit an essay and be like, you know what, that's never the point that wins the day. I'm so sorry to tell you that. And so it isn't. It's never the point that motivates people the most, right? However, if you can say, you know, if you can and tie them together and say, you know, we need to help take care of the other people on the other side of the world so that our health is better and our health is, you know, dependent on this structure, I think that we can create a narrative where essentially everybody benefits. We emphasize that connectivity benefits our health as well as the health of people on the other side of the world. It was like this moment for me where I realized that my innocence had somehow been broken. But that's okay. We can work with that as long as we have insight into it. So let's move from the global to the local. Trevor Hancock, who's a public health legend here in Canada, and in fact is somebody, whenever I go anywhere else, there, you know, I was in Argentina recently, or sorry, Chile, and they were like, do you know Trevor? I'm like, yes, I do. And so he's really created a lot of our narrative here. And so he wants to know about, he noted the fragility of globally distributed and centralized agri-food systems, and then also talking about the importance of the community, social connection, and the local. That's certainly something that I've been really feeling during this pandemic. I saw actually just before coming on that Kate Raworth has started working with C40 to bring the donut economics model to the city-state during recovery in sort of a systematic way. So Alistair, could you sort of give us a sense of your thoughts right now on, you know, moving from the global to the local, how you see COVID-19 having changed the sort of game a little bit and how that applies to climate and planetary health more broadly?
Yeah, I think that, I mean, in a sense, there's been a huge amount of solidarity, isn't there? I think that one of the things that is interesting is that people are quite intrinsically collaborative. So, and they tend to pull together in times of crisis. So I think that, can everyone hear me, by the way? Yeah. My screen's frozen, but I'm assuming you can hear me. So, you know, I think there's definitely some, there's a sense of opportunity in terms of people pulling together and collaborating for a common good. But I think that what's interesting is it was government-led still. Certainly my experience is that people were more or less did what they were told when they were told. So when they were told that they needed to all pull together, then they did it. But people didn't have that kind of coordinated, you know, action without some kind of leadership. And I think that one of the debates that's often comes into kind of the environment in general is this notion of personal action versus kind of structural change, and the need, you know, what's the balance between these two things. And I think within the climate movement, there's kind of a bit of a sense that people, when people focus too much on personal action, it's basically lets off the governments and the large corporations who are just saying you just need to make better choices. But actually, the way that the system's structured doesn't actually necessarily make it easy to make better choices. So I think that, of course, personal choice is a huge, important part of the environment movement, but I think it shouldn't be overemphasized. It's not, we need these kind of structural leadership decisions. And I think that people need leadership to rally together as communities. So I've sort of rambled around a bit. I think it's very positive, and I think we've had some positive experiences, but I also think that we need to see that same level of leadership in climate and in environment movement that we've seen here. And I think it was much easier to make these kind of statements as a short-term measure, or potentially short-term measure, than to sort of set out a whole series of changes that we need to make more structurally that might prove unpopular. So I think that there's positive there, but it's not necessarily easy to translate into a kind of a more systematic change. I'll stop now.
Yeah, I think that may, though, also contribute to a narrative, like be a helpful narrative piece, saying, hey, we saw that in order for us to each decrease our chance of getting, COVID, we needed to change all of society. And so us staying at home really mattered, but everything else needed to change at the same time. So I think it might start to become a way that we can explain that to people. I'm looking at a couple of really good questions around military. So, we talk about different determinants of health. We don't often bring conflict in. Peace is a huge determinant of health. And there's this interesting sort of several links between, the greenhouse gas emissions produced by the military, and which are large. And I didn't actually know this. So apparently their GHG productions are exempt from reporting to the IPCC. Does anybody want to comment on that, and whether, the situation with regards to that has changed with COVID? To me, this is sort of how this sort of resonates for me is, to me, COVID has sort of shown, it's laid bare really how the lack of depth in the fabric of our global society. And to me, any instability tends to feel like it's leading towards increased potential for conflict. Yassen, do you want to comment about greenhouse gas emissions and conflict?
Not my most central area of expertise. I think that things that we can think about here are basically the environmental impacts that cause constraints on resources that are the source of many conflicts around the world, of conflicts and then displacement eventually. So there are links there, particularly around the accounting of military budgets, of military greenhouse gas emissions. I think that comment probably relates to the fact that they use a lot of bunker fuels, which are not within countries' emission budgets. But I don't know much more about that. This being said, I think that some things that we've seen with COVID around the world is that there's been kind of pauses in areas where there is civil conflict in certain areas of the world. I don't know if the net positive is beneficial. It may not be. There's been a lot of elements of increased violence, more at the very local level, intra-household violence, violence against women and children. So there's certain elements that kind of cross over there, different kind of, possibly a displacement of where violence happens. So I don't know what the net effect would be. I wouldn't be able to say much more to that.
Yeah, I think I have seen a lot more violence in the emergency department, and I know that that's not just been here in Yellowknife. People are by themselves, they're drinking more, they've been locked up with their family for a really long time. Some of those relationships were on the verge of ending, and now they're here. For me, this is one of the reasons why I think it's really important that whatever narrative we create as a shared global health-related narrative is one of hope, is one of a path to safety, as opposed to trying to scare the heck out of people more. I just don't think that. And also there was a good article in the Lancet from a couple of months ago. There was a review of the mental health impacts of quarantine, and there were super high rates of anxiety, depression, PTSD. And so when we're thinking about our population, I think we really need to be thinking about them as a group of people who are really looking for solutions and who are looking for a path to safety. And so I'm going to just transition into the last question. I'm going to ask both of you to answer this. So this is from Colin Su Chu Lam, who's one of our wonderful medical learners. And so he says, we say that we cannot go back to business as usual, but what keeps us from going back to business as usual? People want to be healthy. People don't want the planet to overheat, but that has long been true. what is our theory of change as physicians academics for how this moment will be different from 2008, for example? So I'll go with Yassen first, and then I'll go to Alistair.
So I think in other talks that have been similar to this, I've kind of hammered more into the fact that I think that we should not be rejoicing for the climate benefits or the environmental positive externalities that COVID has made. I think that it's inappropriate from a messaging perspective, but it's also inappropriate because of the fact that people are dying around the world. The fact that there's less emissions because of that is not a reason to rejoice. This being said, I think that COVID has forced upon many people around the world, changes to the way that they live certain aspects of their lives. And I think that there are elements in that change that may have been uncomfortable, but that people might end up appreciating more. And I think that's where we can find those elements of hope. People may notice that certain things that they did, certain ways of living, certain ways of behaving that they did not know they appreciated, they actually do. And those are the elements that we have to keep in order to kind of walk towards what we would call the new normal. I think there's also going to be kind of that external pressure from COVID will not stop anytime soon. Possibly when we have a vaccine, then that will stop, but there will be imposed changes for a long time nevertheless. So kind of finding that not too uncomfortable place with those imposed changes is also important. I think that currently, kind of one last element before I finish, one very important thing that we've seen with public health responses that has been very intense and probably very much driven by the fact that other kind of basically one jurisdiction doing one thing, the other one doing the other, without any solid public health evidence. And I think we may have overdone it. I think we will in the coming months see the negative impacts of all the measures that we've put in place. I think that it was kind of some people might invoke a precautionary principle, but I think that we also have to think about, whenever we put in place public health intervention, think about the negative consequences that they may have. Closing down certain things will impact populations disproportionately, the most vulnerable populations disproportionately, and I don't think we spend very much time thinking about that, and I think we will need to in the coming months. And as we're reopening, we'll start assessing those things and finding the fine balance of what we need to do to protect people's health from COVID and what we need to do in order to protect people's health from everything else. And in that everything else, there's a lot of things, but there's also the environmental determinants of health. So we can put those back up on the forefront as soon as we stop kind of being very narrowly focused on this one problem. And that's it.
Alistair?
Yeah, I mean, I think it's basically, the reality is this is a politically contested notion, right? So people will interpret this, different people will interpret the COVID event differently with different, in different frameworks, and throughout the political system that will play out. So some people will want to rapidly go back to consumption-based growth model, and they'll be pushing that agenda hard. And other people will be trying to push the agenda that this has been a wake-up call, and we need to recognise that we need to make transitions. We've been able to make some transitions. So I think that the best that we can do really is tell a very compelling story with the events that have happened, and to try and use that to try and place that throughout society, if you like. So it's persuasive for individuals. We already know that most younger people are concerned about the environment and starting to think about these things. The problem is that, and I think one of the things that's a bit concerning about COVID is that it's a bit like climate change in that it's been predicted, this kind of thing, for a long time, right? But we didn't do anything really significant in advance. We waited for the events and then we reacted. And that's generally how society operates. We're quite reactive, and we strangely fund all this research to identify potential risks, but then don't tend to act on it at a societal level until such time that we've been hit with some of the impacts. I mean, interestingly, we're being hit by a whole bunch of climate change impacts, and actually they've been quite detracted by COVID as well. So, the Australian bushfires was an enormous story, is now got completely obliterated by COVID, and there's other fires still raging, isn't it? If I'm not mistaken, I think, what's the state with anyway, one of the states in Southern America has got major bushfires at the moment, and it's hardly getting any news coverage because everything's just completely, you know, COVID's taken all the bandwidth, and I think there is an issue there as well with how we message. But I suppose the short answer is there's no guarantees. The best thing that we can do is to make the case and to make it in a compelling way, and to make sure it's that message gets to people who are in a position to do something with it. And yeah, I think that's basically the cards that we have, whether we like it or not.
Thank you. I'm reading some of the things that Trevor Hancock's putting in the chat, and I didn't know this, but apparently the evidence is that recession increases life expectancy and health, and that it's economic expansion that causes problems. So that's kind of interesting. I would like to see that review, Trevor. I would like to do that again with you. And I think that's really interesting.
In rich economies, that there is some associational evidence, I think.
That's fascinating. We should take a look at that. And I think what you were saying about this response, yes, and not having maybe taken more vulnerable populations into account, I think we really need to make sure that as we're proposing solutions for recovery, we really do have an equity lens on that, even if it's maybe not the thing that we lead with. And I think that, you know, including how we talk about fossil fuel workers and how we talk about, you know, the need to support workers as opposed to, you know, giving big bailouts to corporations. I think it's really important to differentiate those. And to me, that almost becomes an equity issue to make sure that we're lifting up the people who, you know, really are vulnerable with the price of oil having dropped as much as it has. So just looking at, you know, the opportunity of this moment, you know, we have a whole world that's focused on health right now. And we have also a whole world that's willing to listen to webinars in the middle of the week. So we don't often have a sort of teachable moment like that, where we can get a whole bunch of people from different disciplines to talk to one another and learn from one another. And I thought it was interesting what you said, Alistair, about how that's a vulnerable space for people. I think we don't often acknowledge that the minute you take a doctor and stick them in a room full of, you know, economists or energy planners, which is exactly what we need to do, you feel pretty dumb. And then vice versa. And so I think we, you know, coming up with ground rules a little bit for how we interact in different communities. I've found cultures are different between communities too. So things like, you know, there's avoiding acronyms and also sort of assuming good intent to try to overcome some of those differences in culture and emerge. We talk really quickly and we give really direct feedback. I find if I do that in a public health space, people are like, what? And, you know, very different in different places. And so I think that, you know, if we can use this opportunity where we've all just demonstrated how much we prioritize health and how much we care for one another, and then start to use that or suggest it as an overarching goal for society in a way that we rebuild, taking into account the economic, you know, ecological, social determinants of health. I think that's an opportunity we have, particularly using health messengers to help bring that forward. So it's going to be interesting. There's a really big Healthy Recovery sign-on letter going around internationally. It's going to launch in a couple of weeks that will really give a huge lift to that. And so I think as we, I'd like everybody's minds to be sort of percolating on that topic as we can consider how we can, you know, use our messages most effectively, use our messengers most effectively, make sure that we're in the media where we need to be in order to be influencing people. We've seen the media loves this story about the hope. I've had so many media requests to talk about, you know, the clean air. And as Yassen has said, I've hesitated because you don't want to be seen as celebrating, you know, a tragic situation, but that tells me there's a real thirst for a kind of hopeful narrative. So I thank everybody here for, you know, the insight they brought to this conversation today. I wish we could talk all day and then go out for dinner, but, you know, maybe next time. Maybe we can start scheduling longer webinars. And thanks so much to everybody else for joining us. Is there anything, Yassen or Alistair, you'd like to say before we go?
I just say, well, obviously, thanks for having me. But I think that there's perhaps going to be an interesting moment for climate, which is that because the COP's been delayed, it's going to almost coincide with the next assessment report from the IPCC. So I think in early next year, there's going to be a real moment for climate media coverage, which is, I mean, it'll be interesting. We don't know whether it'll be a good moment or a bad moment, depending on the outcome, but it will get an enormous amount, almost certainly will get an enormous amount of media coverage. at that time, and there will be, so that I think that's just something that's worth having, you know, bearing in mind. Yeah, that's it. Thanks very much.
Awesome. Yassen? Good.
Oh, thanks.
Awesome. Okay, thanks to everybody for joining us. One thing we do know about what's going to get us to where we need to go is trusting relationships between borders, between people, between disciplines. So thank you very much for what you've done today in participating and helping us to generate that web, because that's what's going to get us to where we need to go. So have a great day, everybody. Really appreciate your joining us, and join us for the next CAPE webinar, which is...
Yeah, I was just going to jump in and say the next CAPE webinar is next Thursday. It's half an hour later to accommodate our medical students who are coming on to tell us about their campaign and their work to get climate change taught in med schools. So CAPE webinars are going to be every Thursday for the most part at this time, which is 11 a.m. PST and 2 p.m. EST. But stay tuned for more information. And again, thank you all so much for joining us to speak. Have a great rest of your day.
Thank you.
Everybody.